Reading a prescription from the doctor's office may seem confusing at first, but whether you're a new tech working in the pharmacy or a patient trying to take more control of his or her health, it is a great thing to learn. One large part of what may make it seem daunting is the usage of Latin abbreviations and other symbols. Pharmacy SIG codes, as they're called, are shorthand for dictating the medication instructions. It comes from the Latin signature, meaning let it be marked or labeled. In terms of how often, many common SIGs start with Q, meaning every. So once you know that, it becomes easier to know many others, like QH, QAM, QPM, QHS, QD, QOD, and QWK. BID, TID, QID, and PRN are also other common ones you'll see. Some SIG codes relating to when to take the medication are AC, PC, HS, AM, PM, and C. There are also much more to prescription medications than pills and tablets, like otic drops, ophthalmic drops, creams, ointments, suspensions, and injectables, for example, which is why it will not always be by mouth. Going along with this idea of different forms, they also have different instructions. You can find SIG codes relating to where to use the medication on the person's body, like OD, OS, OU, AD, AS, AU, and PO. Some other methods of taking the medication include rectally, vaginally, intramuscularly, and by the cheek and gum. Other aspects on the prescription to look out for are quantity of the medications and dosage, variant delivery like sustained release and extended release, whether there are refills and if so how many, and if the brand or generic was prescribed by the prescriber. If you work in the pharmacy, it's always good to double check you're dispensing exactly as prescribed. Doctors make mistakes too, though, and sometimes a pharmacist may need to verify if something seems off or if some information is not included. If you're a patient, it's also always good to verify your medication as well. Knowing what you're taking is always a smart choice. You can always ask for an explanation of the instructions and the purpose of the medication too before leaving the prescribers. Educating yourself about prescriptions is a step in the right direction. Medications are beneficial when taken correctly, but people can always make mistakes, which is why everyone should do their best to make sure that doesn't happen and the patient continues on a healthier path.